Hello, this is Dr. Ordonez. Thank you for your patience. Okay, so the first question I did address, but I am going to just go over it again briefly. And the question is, do you find diagnosis and treatment for this disease is less in urban areas? And I have reviewed the evidence that shows that older adults living in rural areas may actually face more barriers to obtaining a diagnosis of Alzheimer's disease and related disorders than those in urban areas. And Dr. Lisa Wiese presented recently on this FAU Virtual Research in Action platform, and her talk may provide guidance regarding this topic as she discussed healthcare disparities in rural and ethnically diverse communities, including health literacy and cognitive risk of dementia in older adults, and also dementia and Alzheimer's disease risk factors. So thank you very much for your question, and I hope that provides some clarification. Second question, is it true that if you have Alzheimer's disease, you can have dementia, but you cannot have dementia without Alzheimer's? Okay, so thank you for your question also. If you have been diagnosed with Alzheimer's disease, you have dementia. Alzheimer's disease is one type or cause of dementia. And in my presentation, I showed that umbrella with the name dementia on it, signifying that dementia is an umbrella term. And for example, the causes of dementia, such as Alzheimer's disease, are just, types of dementia. So you can have dementia also without having Alzheimer's disease, because this type of dementia can be due to other causes. For example, as mentioned in my presentation, some causes of dementia include Alzheimer's disease, vascular disease, frontotemporal dementia, Lewy body dementia, to name a few. And I also wanted to add that it is possible that someone with Alzheimer's disease diagnosed by examining the brain pathology after death, so in the autopsy, did not exhibit symptoms while alive or was not diagnosed with dementia. Now, this may be due to the person's ability to compensate for the disease and the symptoms. So this is a very, very interesting concept. And the evidence that, some people can tolerate more of these changes than others and still maintain function is really fascinating. And it is said to have to do with this cognitive reserve that studies suggest that can be due to educational and occupational attainment and leisure activities in late life. So all these factors can help increase this reserve. So thank you very much for this great question. Now the next question is it true? I heard it is genetic and it skips generation a lot. Is there truth to that? Okay, so research shows that persons who have a parent or a sibling with Alzheimer's are more likely to develop the disease than those who do not have a first-degree relative with the disease. Now, those who have more than one first-degree relative with Alzheimer's are at an even higher risk, okay? And so when diseases like Alzheimer's and other dementias tend to run in families, either genetics or environmental factors or both may play a role. And the vast majority of people with Alzheimer's disease do not inherit it from a parent as a single gene mutation. So this is a little more complex. And so instead, we see that the inheritance follows a more complex pattern. So also we see that indeed the disease might skip a generation, affect people on both sides of the family, or appear seemingly from nowhere, or even not be passed on at all. So there is a lot of variation of what we see. So thank you for for asking this question. Now, the next question is there anything new with research to slow the Alzheimer's disease? And currently, there are drugs in research that target that tau protein that I spoke about, which, if successful, may have the potential to help stop the progression. But there is, ongoing research, and so we do not have conclusions on this. There is also ongoing research on existing drugs used for other medical conditions that could target the inflammatory process, but not available, so still under investigation. So again, there are multiple research studies, and it is our great hope, right, that soon we can have some light into treatments that can actually slow the progression of this disease. So thank you for your question. Now, another question is taking a memory supplement useful for memory, such as prevagen? Okay, so many challenges as a consumer, being overwhelmed with so many choices, right? And so I am going to give credit to my answer to a colleague who recently presented at our center about these supplements that claim to have, right, these beneficial cognitive properties. And so the multitude of choices leaves us with much difficulty in evaluating these supplements. There are challenges understanding the scientific studies, in their proper context. And so also appropriate dosing and form. Do they match really what's in the research? And also, are we able to determine the active ingredients and also finding a reputable brand? And so this is a very, very interesting subject. And some questions to consider before choosing a dietary supplement, may include the respect of traditional knowledge of uses. For example, does it have a long-term historical use? Do the current market product uses reflect that historical use? So is there an indication? Also, is it critically able to evaluate the claims and evidence? Are we able to have that understanding? Identify brands with consistent record of effectiveness, and be aware of choice overwhelm. When we have so many choices, we may need to take a moment and reflect before we make a decision. And so get your healthcare provider's approval. That is my strong recommendation before taking dietary supplements, and either in place of or in combination with prescribed medications, because they may affect each other, either potentiate, strengthen their effect, or decrease the intended effect of the medication. And so another issue is that, for example, if you're scheduled to have any type of surgical procedure, please talk to your healthcare provider, because any supplements may really alter your health. So thank you for bringing up this topic. Okay, another question is, at what age a healthy adult should start getting screened for cognitive function? And where should adults go for screening? Okay, so actually in February of this year, 2020, the U.S. Preventive Services Task Force released a recommendation statement on screening for cognitive impairment in older adults. And this task force concluded that more research is needed to make a recommendation for or against screening. So we don't have a conclusive recommendation. So we will, wait and see if that changes in the future. But I can recommend for now that noticing any changes in the person's baseline, right, or usual functioning may give us, may give an indication really of whether a cognitive screening or a more in-depth evaluation may be appropriate. And so sharing these concerns with the primary care provider is strongly recommended. And the warning signs, as I explained in my presentation, can be identifying, areas to bring up, for the need of a cognitive screening. And certainly if, the person is having confusion or motor coordination, right, that mobility, and then loss of short-term or long-term memory, as we talked about, or impaired judgment, and any changes in behavior that interferes with the routine or normal function of that person. So think about, change. Is this a new behavior? Is this a new challenge? And so if so, please be on alert and then share with your primary care provider, or call us at the memory clinic or any other memory disorder clinics, so we can give you some guidance regarding that. So thank you for your question. And another question is, if someone had a fall that caused a concussion during their youth, would this increase the probability of developing dementia? Should this person be evaluated as he or she reaches the age of 60? And then the person who's asking says, thank you. Well, so thank you for the question. And let me explain that over the past 30 years, research has linked moderate and severe traumatic brain injury to a greater risk of developing Alzheimer's disease or another dementia. And so even years after the original head injury, okay? But we're talking about moderate and severe traumatic head injury, okay? Now, a concussion, as you present, is a mild form of traumatic brain injury. So there is no evidence that a single mild traumatic brain injury increases dementia risk, okay? However, emerging evidence does suggest that repeated mild traumatic brain injuries, such as those that can occur in sports, like American football, boxing, hockey, and soccer, may be linked to a greater risk of chronic traumatic encephalopathy, as we call it, which is also a form of dementia. So even though a mild concussion would normally not result in a dementia, when the mild concussion repeats itself, right, that injury over and over, then is when we can have a big problem. And so a person having had a concussion during their youth should be evaluated if there are signs or symptoms of change in cognition. However, if the person or family is concerned, this should be brought up to the healthcare provider. So a baseline cognitive evaluation may serve to decrease anxiety regarding possible harmful effects of the concussion and have a baseline for comparison on a yearly basis or as medically appropriate from that point on. And so again, if there is still concern about that past injury, share with your provider, and it may not be a bad idea to have a baseline. And then also, as I explained, this may definitely decrease the anxiety or the concern. So thank you very much. This is also a very important topic. Okay, and I believe this is the last question. Is Alzheimer's disease still considered a 7 to 8 year course? And can you talk about the value of early diagnosis? Okay, so thank you for your question also. Now, the rate of progression for Alzheimer's disease varies widely. So on average, people with Alzheimer's disease live between 3 and 11 years after diagnosis, but some survive even 20 years or more. Okay, so it varies greatly. Now, The degree of impairment at diagnosis can also affect life expectancy. Okay, so it depends at what stage in the disease is that we make the initial diagnosis. And some literature has that, for the mild to early stage, it could be 2 to 4 years, moderate to middle stage, 2 to 10 years, and then severe or late stage, 1 to 3 years. But again, this varies. So different types of, literature may present different stages or different ages. And then I want to remind you what I explained earlier, that everybody is different. So we may have a guide, but then, the person individually may progress differently, even if we have, a pattern, a general pattern. And so to your question about asking me to address the value of early diagnosis, we say that early and accurate diagnosis is key, right? Talking about the key ingredients as the title of my presentation. So early and accurate diagnosis is key. And there are many documented advantages to obtaining an early and accurate diagnosis when cognitive symptoms are first noticed, okay? And so these advantages may result in a higher quality of life, less stress for family caregivers, more time to treasure the present, the moment, and increased time for planning for the future. And also remember what I talked about, to include the person with dementia in the planning. So the earlier that the disease is detected, then the more time that person has to be an active participant in her or his decision-making and future healthcare choices. Now, also, it is important because, your symptoms might be reversible. Remember, I explained that potential symptoms may be caused by a condition that is reversible, such as the vitamin deficiency that I explained and the thyroid issues that we discussed. And so also, because time is of the essence, Alzheimer's and other dementia-causing diseases are typically most effective when started early in the disease, okay? So the treatment, it is typically most effective, okay, when we start early. So an early and accurate diagnosis is crucial, especially as research leads to better treatment options, okay? And so, the person and family can focus on what matters most also when we can diagnose early, and also use the resources available, to the family. They can participate or advocate for research, and also you can further people's understanding of the disease. So you can help other people with your experience as you develop and progress in the disease. So when we learn, to associate the disease with people in the early stages, we understand that they're still viable in the community. So, you can spread the word as to how valuable and dignifying is any life, whether it has, another disease or the diagnosis, the disease of dementia. And so, as I explained, there are many, many benefits for early diagnosis, for the patient and also for the family. So thank you very much again for asking the questions and for listening to my answers and then consider them. It is my hope that they may help you, guide either your loved ones or in whatever capacity that you are. You may be a caregiver or a teacher or, just somebody who is aware of your brain health. So thank you again very much. And, this is my information, and take good care.